you based on the experiences I narrated. When I was a little boy, many moons ago, I lived in a village, about 200 to 300 families. The healthcare I know is when I feel sick, I go to my home, I go to my room, sleep in my bed. Now, my mommy will take, do some wonderful, whatever she does, and bring back and feed me, and it's wonderful home cooked meal. And whatever she gives is the medicine. And the doctor will come in. He will visit us. He's a family friend. He knows me. He knows my medical history inside out, because from the kid born, baby born, he has seen me. Of course, he will come there and say, "Okay, Mohan," say, "Ah." And I say, "Ah." For a long time, I thought maybe there's my medical chart is there that is reading in my tongue. See, how we could figure out we just look in my tongue what's going on? Very complicated. Then he will tell my mom what she should give me. She will tell me, "Mohan, okay, don't worry, you'll be all right. We can play ball in the next couple of days." Make me calm and happy. They'll give tell my mom and dad what to give, all the medicine, everything else. And his fee will be a nice home cooked meal. So he is taken care of by the entire community. And everybody knows everybody. It's a synergistic environment. And the healthcare is so personal. That is one extreme example of what healthcare experiences. Am I satisfied? Of course I'm satisfied. Doctor only gave me the medicine I didn't know existed. Like little things, and they're all sweet. Wonderful. So now, after so many years, I go, now I'm sick, I go to a hospital. I'm supposed to go to a clinic. I go to a waiting room and sit there. And as soon as I walk in, I go to the counter and they put a piece of pads and a bunch of papers saying, "Here it is, fill it up." I look and say, "Oh, so many symptoms. I feel guilty, I only have a few. Maybe I should fill up all of them." Right. Well, anyway, I fill up something. Maybe ABCD, so they fill the pieces. So I sit there, and there are all the other people with all the sickness. Now I know why. Whatever, regardless, doesn't matter what sickness you went into the clinic. Now that in the waiting room, you're going to be in contact with all the other people, and you'll have all the symptoms that you wanted. You're going to contact every possible disease that is there. So now your life is done, right? And then you go there, you go to a single separate room, and you wait there for a while, waiting and waiting and waiting. And finally, door opens, and God walks in. Wow, the person, doctor, you want to see him, you've waited for so long, passed through so many gates. And he looks at it, and he also says, "Ah, that hasn't changed in 30 years. He's still trying to read my medical chart in my tongue." And he gives some medicine, which I go pay, and all the other stuff. Very impersonal. Do I feel satisfied? You be the judge. So now, you know what yesterday was. You know what today is, medical care. Everything is going to go tomorrow. So Obama says you have to be satisfied. If I have to beat you up, it doesn't matter, you are going to be satisfied. We all have these mobile little things. See? This is going to tell us everything we need to know about us. Doctor is in this little device. And we are going to decide, we are going to have these guys, not everybody. I'm sorry, but I'm trying to give a perspective on where it is going technology. So we're going to have this little device with 100 buttons, and we're going to figure out what it is. Or mine, the guy who's holding it can read. Not to read, but we're trying to fit this. This is a tool. This is a device which is equivalent to a computer, an input-output device. It's basically what it is. It's convenient. I can put it in my pocket and I can go. Like the old, IBM PC days, portable IBM PC, you put it from power to, they took a big machine and put a handle there saying it's portable. It's smaller than that. That's all. healthcare experience. Obama says that we need to have, everybody needs to be satisfied, and we don't know what satisfaction is. And already, if you do the Google search, you will find that. So you see that. Magic. Mobile technology. So what happens is, nurses are asking, what is healthcare making happy people mean? And the comments made are, no, hospital is not a hotel, it's not a resort. If you want to make people happy, you can have a frequent hospital visitors program. You come 10 times, you can get the next visit free. Or maybe you get one bed, hospital bed, you get the other hospital bed free. Satisfaction and the experience in healthcare is very different from the experience and satisfaction you get it from a commercial world. It's all about emotion. So when healthcare experience starts when a patient observes a symptom, I got a headache, I got a little pump, whatever it is, that's the time healthcare treatment starts and ends, hopefully, when the disease is cured. And throughout everything, the doctors, nurses, patient interaction is only a small portion of it. It's a lot before and lot afterwards happens. So our model is, in the healthcare experience, without the benefit of any of this stuff, let me try to bring it as it is to have a platform where we will collect the data, and all the data is qualitative. People, when they are sick, are inherently nervous. They are desperate, they are looking for answers. They are looking for answers from their friends, from doctors, from nurses, or whoever it can be, maybe internet, whatever it is. And our approach should be to be sensitive to that and see what the patients need, what are they doing, collect the information as non-intrusively as possible, interpret it correctly, and use that to cure them. The best patient is a patient who is cured and gone home and do everything else and never come back to the hospital with that disease or any other disease. So with that as a context, what we did in healthcare experience, of course, is healthcareexperience.com, I invite you to go there, is a platform where all the other people, all of my wonderful colleagues who are building the website and the mobile platform, everything, and collecting the data, they can put it there. Hopefully you'll have a data model where they can add their data, they can add data, share it, so that it will be a community environment where the data will be collected and sorted and shared, so the doctors and nurses can see and convert this qualitative data into quantifiable metrics. And these metrics will determine whether a patient is satisfied or not in a meaningful way. Instead of letting some bureaucrats decide, I'm going to take a survey and young people answering the question, we have to have more meaningful, and it has to come from an industry, or the community, or the organization-based approach coming in. It should be groundswell-based approach. This is what happens in IEEE, standards bodies, and everywhere else. We don't wait for the government to dictate. The industry groups define the recommendations and standards about what we think collectively a good quality program should be. And I'm trying to propose a similar model here from architectural point of view. So the data collection in the healthcareexperience.com will be open, it will be freely available. We already have a platform, a component in which we are measuring the food and nutrition and exercise and medication history. And we are developing mobile platform that will allow us to collect this data. We already have a web-based data, and hopefully if I have a chance I will show you. It's called liveligood.org. Again, personal, very personal, no personal information is collected. I welcome all of you to go and open an account and use that as a personal diary. It's a global healthcare benefit. If you go to healthcareexperience.com, there's a link to that, and you can use it. So we want to treat the whole patient in a holistic fashion. From the beginning, from what is their entire life around, so what do they eat, what do they do exercise, what are the problems they have, how do they communicate, where do they get the information, how do they talk to the nurse, and how does the nurse respond, and how the doctor responds, and how they communicate with the doctor in a meaningful way. The whole works. At every point in time, we will have interfaces with mobile. And mobile, we will provide the mobile developers the open basis on which the data is going to be collected. What kind of a data we want that can be converted into a quantifiable metrics that can lead to a good analysis, and so that whoever wants to use it can determine whether the patient is really happy or not. So without the benefit of any of the slides, any other things, I put you guys to sleep in the 20 minutes. So I'll be happy to answer any questions here. Okay.
So, without seeing it, obviously, it seems like a lot of what you're talking about is similar to websites like Pages or like Google and things like that. How do you sort of differentiate yourself in that space? What do you do?
There are, if you look at the whole scheme of things from the early on, initial input of the symptom to the final tool, there are lots of people who will be there overlapping because of how we're talking about providing service. It's not just a website, it's also the mobile carriers, it's also it's also blogs, the whole works. The thing I'm trying to do is mobile and non-mobile data. We want to collect the data which is relevant to identify patient satisfaction. We're not trying to be end-all in everything. We're not trying to educate the patient how to treat and how to cure themselves. There are many sites that do that. Many sites will share all the information. Yeah, I got this symptom, who else has it, and what do we do, compare notes. So kind of social networking, there's a lot of it. We are only trying to see from the doctor's point of view, is the patient happy? And what are the parameters that meaningfully go in there? And collect that. What are some, how do we measure it? Do we measure it by saying how many times the nurse smiled? Is that a quantifiable data? I don't know. I mean, there are so many open questions, both from the caregiver's point of view and from the patient's point of view. How do you determine somebody is happy or not, satisfied or not? Very vague. And we are only focusing on that. But unfortunately, the question is vague enough that we have to overlap with many other things.
When you talk about collection of data, the major challenge in the industry is whether you do it in a big data. The three things: privacy, security, and access consent. Right? Access consent based on the role. If I'm the dean of the hospital, if the patient is not my primary patient, even I cannot see my wife's or children's data. So that kind of access and role-based consent, and also privacy. There are international laws, federal law, tribal laws, and state laws. So you have to deal with, where you collect the data, who owns the data, because you get security breaches, privacy breaches, HIPAA and other things. How do you deal with it?
HIPAA and privacy issues is pervasive. Anything you touch or talk about healthcare, the first thing that will be probably number one. And we grapple with that quite a bit. I'll give you an example. Suppose I'm in the hospital and I want to have a mobile device, which is one of the things we are planning, and there are other people doing that similarly. And they want to know if there is food is hot. We do not want to collect the patient's information. All I want to know is the bed number. And the doctor will know, or the nurse of the hospital will know that at 8 o'clock in the morning on Thursday, XYZ was in bed number 45. For my system, all I want to know is person in bed number 45 is not happy with certain things. So purposely by separating the two, okay, we have to be careful that we don't really collect information one, or if we do collect information, we want to maintain consistency with HIPAA regulations if we have to do that. Okay, so HIPAA, while it is giving all the reasons, they are not trying to prevent our progress. So there are ways out of that in a meaningful way. But whenever possible, like for example, the product that we have for livelihood, which is the collecting the food and nutrition information, we don't collect any private information. The only private information we have requested them is the email. That is because we have to check the password, resetting password. And we told them, go get a Hotmail account. We don't need to know who you are. Okay. Other than that, I don't know where, what's the name, address, phone number. I don't collect any of those things. So this is one of the many approaches like that. There are other ways also to do that to prevent HIPAA being the blocking practices. I can talk more about it.
Are you able to establish like a baseline that would, for doctors so that settings or prevention from part of the volunteer metrics? Or I guess I'm not sure. Yeah, like, how is this data really being used? And is it used in aggregate or in individual?
We started out developing mobile solutions and web solutions on this problem in bits and pieces. And we still do. Those are all in the works and we can demonstrate some of them. But while doing it, I said, what problem am I solving? If I'm going to build yet another mobile app, that's not really solving the problem. I built a mobile app. Oh, I think happy thing. That's not a goal. What am I doing here is we're trying to build an industry consensus, saying that what is healthcare experience in healthcare context mean? What should we be doing as a group, as a community? Because if the communities come in and tell what realistically they see and what they can do, then the answers would be more meaningful than somebody sitting there in a corner and telling what to do. I'm trying to set that in motion. As a part of that, while we have individual devices and individual mobile solutions are have their own place, the overall architecture, the combination of that has to be, by definition, a consensus-based solution. And we are putting together an architecture for that, and we're opening it up. So, work with us, help us, let's build a good system that we collect. Now, if Obama and company wants to come and use this information, welcome. If they want to do something else, welcome. This is an open environment. That's why I gave you the example of IEEE standards. Standards are recommendations. Nobody is required to forced to use any of them. Same way here. If enough critical mass of people identify these solutions and say, this is what we're collecting, this is what we're going to interpret, other people.
So I'm looking at patient satisfaction as kind of a multi-dimensional space. And how does one settle on where the optimal position in the space is? For example, think you mentioned in the x-axis, think of patient satisfaction with the encounter, on the y, satisfaction with the outcome. Right? Patient can be satisfied with the outcome, not really satisfied with the encounter, or vice versa. How do you interpret that type of multi-dimensional? No, it's just two-dimensional, but many more dimensions. How do you interpret what satisfaction really means?
That's the gist of the same problem I've been grappling with. When I'm cured, I'm happy, but when I'm not cured, same issue. Am I treated well? Am I cured? It's a very highly intense emotional reactions to people. We have to measure many things, and we have to learn as we go through and heuristics. Okay, what parameters are relevant to a large community, and based on that, we have to quantify. I don't know the answer.
Who's your customer? Who are you trying to sell this platform to? To institutions, to practices? Are you going to publish data for patients to make decisions about where to go?
Platform, I'm not trying to sell to anybody. Okay, I'm opening it up as a discussion item. I'm welcoming anybody and everybody to come in and help us grow. Individual components in that, whether we build the mobile or we allow the open interface and other people build the mobile. There's opportunity for people to do, and including us, to do that and build and market products. This is a basic enabler. So long as you plug into this data is meaningful to somebody else. Most of the time, when we can build a mobile, particularly in this kind of space, the data gets collected, but each data, you got a doctor and you got 100 applications, each of them have a data of its own in its own way. And you're going to be totally confused what it means. There needs to be a seamless way where all the data feeds into and can be interpreted. And they're trying to build industry consensus on that. If somebody wants to give us sponsorship money, I'll be happy.
Thank you so much, Mohan. Our next speaker is Sami.